Welcome back. Heart disease is the leading cause of death for men and women, and diet is key to preventing it. In fact, Heart and Stroke Canada says that 80% of premature heart disease and stroke can be prevented through healthy behaviors within our power to control. So first of all, Dr. JJ, let's just talk about the significance of that, the fact that diet is responsible for more deaths than any other cause globally, more even than smoking tobacco.
Also, what's encouraging and rewarding for patients is that this is something that's under control. You could control your diet.
But what is it that we're putting in our diets that children as young as 10 are seeing the first signs of heart disease?
More of an inflammatory diet, processed foods, leaning more towards healthy diets, like my colleague over here talked about in terms of the Mediterranean diet. I mean, if you're really trying to prevent heart disease, you definitely have to start with the diet. Genetics is a component, but you have to start with the diet. Fish, I consider a fish a superfood. I know it's not great for the oceans. I apologize, but I mean, we know the vendors, the supermarkets are trying to have it be more sustainable. But great data on fish, great for preventing dementia, great for helping with fat profiles. We disagree on some of the research in terms of what it does to cholesterol and so on, but I mean, you can't really disagree with fish.
Now, the dietary guidelines were updated a few years ago and really recommending protein from more plant-based sources. Should we be cutting back on red meat?
Yeah, I mean, I think there's been some evidence recently, since this was 2012-13, those guidelines were changed. And what we know is that the type and the vehicle with which you're consuming some of these things, such as meat, is really the issue. People are consuming processed meat, a large part of what they're consuming. And that is really the issue, is the processing. You can have meat and animal products in your diet and still maintain a very healthy diet. It can still be a Mediterranean pattern, but the issue is really the processing. So often we have people reaching for packaged foods, convenience foods. Unfortunately for families that are busy, there's some thought around, children's snacks and children's quick and easy meals. The whole concept of food needing to be quick and easy and convenient, unfortunately, has left us in a trap of consuming very high levels. Canadians, up to 70% of our diet is processed at an ultra-processed food.
Also takeouts too, right?
Absolutely, takeout.
Like crazy.
People don't make, plain kale and sell that in a bin.
Dr. Ferland, you would be mistaken in thinking that low-fat foods would be good for your diet. I mean, you walk into a grocery store and everything smacks of low-fat. In fact, it's the opposite, isn't it, when it comes to our hearts?
I think it's always a question of to whom you're dealing with. We do promote lower fat, basically to get for the lipid profile and because I think the statistics show that there's a lot of dyslipidemia. And so, this is one way, one out of many ways to perhaps help control that.
I think it's really important to consider that we have to take it all in the context of, like they've done studies where they did a head-to-head study between just vegan diets versus Mediterranean diet, and they found that despite the low cholesterol levels, those in the Mediterranean diet had lower inflammation within the endothelial vessels. So that speaks to the healthier fat in the Mediterranean diet and the importance of eating healthier fats. So
things like nuts.
Nuts and olive oil, extra virgin olive oil. There's so much evidence for that. So just introducing things like that into your diet can have profound effects.
We talk so much about inflammation. And one thing increasingly that people are associating with inflammation is dairy. Is it good or bad? I mean, what's your advice?
So I have an issue with dairy. I love the farmers of Canada. So no offense, but I react to dairy, and I have some patients who react to dairy. Not everyone reacts to dairy. Maybe some people here might or might not. So I'm not anti-dairy. If you don't have a reaction to it,
does it cause inflammation?
It can if you react to it. I've seen patients react. I mean, you don't want to go hear my sob story, but I mean, I get joint inflammation from it and other stuff. And then patients, eczema, asthma, I've seen worsen if you react to it. But not everybody reacts to it.
Which means there's not like a broad-based statement. Like if we say, is cigarette smoke bad for you? Smoking cigarettes, yes, it is for everybody. We don't really have something that says, dairy causes inflammation. That's not in the data. However, of course, you have to follow your own body's how your body's feeling. Something like I demonstrated with kefir, fermented dairy, many people actually tolerate well. It's a cultural food around the world for many people, and it can actually have a lot of health benefits. In fact, the studies looking at heart health in particular, an older model that's very similar to Mediterranean, the DASH diet, Dietary Approach to Stopping Hypertension, work done out of Harvard, actually shows that consumption of some of these fermented dairy products on a regular basis actually lowers your risk of heart attack and stroke.
Okay, so before we throw to break, I am curious because when people choose to change their diet, they make pretty extreme changes to their lifestyle.
Right.
How quickly should someone expect to see a difference in their bodies? I mean, in terms of plaque being dissolved from your arteries being clogged, is that something that we can measure?
Well, you can, but I mean, it's going to be a very gradual process. And also, too, I don't know if you necessarily see a regression in plaque in your arteries. I mean, it depends why someone is making this dietary change. If someone has eczema, you should see a change in 2 weeks if you react to dairy. And also, too, as a caveat and also a warning, too, you do need a substitute. I mean, we're a milk culture, at least in Canada. So, I mean, there's almond milk, there's oat milk, there's coconut milk, macadamia milk, and so on. What I recommend in patients is rotate, because if you start to become too obsessed with a milk substitute, you might start to react to that, and then the same problems happen.
When the Canadian Food Guide was revised in 2019, I mean, dairies were still present, you know, as a food, as a healthy food. So perhaps because I'm a Quebecer and because, you know, we love our cheeses, you know, it's certainly a category of food that is extremely nutritious, and the quality of the proteins that we find in dairies, you know, are very high. So I think that we have to be cautious here with broad statements for this category of food.
All right, hold that thought. We'll be right back. On the other side, don't go away.